The old man leaned back in his chair at the local diner, the smell of fresh coffee drifting through the air. He glanced at his friend across the table and asked, "Did you know your mouth might be the first place to warn you about diabetes?" His friend frowned, surprised. Most folks never think of their gums or tongue as a messenger for something so serious. But over the years, he'd heard stories of people who ignored simple signs, bleeding gums, strange taste, a persistent bad breath, until the doctor delivered news that changed everything. The truth is, those little discomforts aren't always just part of getting older. Sometimes they're the body's way of waving a red flag long before the real damage sets in. And for some, paying attention could mean saving not just their teeth, but their vision, their energy, and even their life. He remembered a neighbor named Joe, a man who always had a quick smile despite his years of hard work on the farm. Joe's trouble started with sore gums and a stubborn mouth infection. He brushed, he rinsed, he tried every trick from the drugstore, but nothing seemed to help. It wasn't until his daughter insisted he visit both the dentist and the doctor that the truth came out. His blood sugar had been dangerously high for months. By then, the infection had spread deeper, and the recovery was longer than it should have been. That's the kind of delay too many folks experience. Not because they don't care, but because they don't realize the mouth can tell a story the rest of the body hasn't yet revealed. Many people think of diabetes only in terms of sugar, needles, and diet changes. But diabetes is not just a blood problem. It's a condition that can affect the eyes, the nerves, the heart, the skin, and yes, the mouth. When sugar levels in the blood stay too high, it can weaken the body's natural defenses, slow down healing, and give bacteria a perfect playground to grow. In the mouth, this means more swelling, more infections, and more damage to the gums and teeth. What's worse, these mouth symptoms can appear before a doctor ever says, "You have diabetes." That means catching them early could be the first step to avoiding years of complications. She had seen it firsthand in her own family. Her sister began noticing her gums were bleeding just from flossing lightly. At first, she blamed a new toothbrush. But then came the dry mouth, the lingering bad taste, and the constant thirst. It was only when she mentioned it during a routine dental cleaning that the hygienist suggested checking her blood sugar. The test confirmed it. Type 2 diabetes. "If only I had known these signs earlier," her sister would later say. It's a common regret, but one that can be prevented if more people knew the connection between oral health and blood sugar levels. That's why this message matters for anyone over 60, especially those who may already face other health challenges. Simple mouth symptoms can be overlooked for years, but they can also serve as God's gentle tap on the shoulder, urging a person to get checked before it's too late. Today, we'll explore these lesser-known signs one by one and explain how they connect to the bigger picture of diabetes. Some might surprise you. Some might even explain problems you or a loved one have had for years. But each one is worth knowing because listening to your body, yes, even your gums and tongue, might just be the thing that protects your future. Number 1, severe gum inflammation, periodontitis. The trouble began quietly, with no sharp pain to warn him, just a strange tightness along the gum line, as though his teeth were being gripped by invisible hands. At the church potluck, he mentioned it to a friend, a retired dentist who had seen this story play out countless times. She explained that severe gum inflammation, known as periodontitis, is not only more common in people with diabetes, it can be 3 times more likely to occur and 3 times more destructive. The condition isn't just about puffy gums. It's a deep infection that slowly destroys the bone that keeps the teeth anchored. For someone with high blood sugar, the immune system's ability to fight back is weakened, and what begins as mild swelling can turn into tooth loss before they even realize the danger. Back in his younger days, he'd seen his cousin Martha lose her confident smile to this same problem. She was the kind of woman who could light up a room. But over time, her gums began to pull back from her teeth. At first, she thought it was simply age catching up to her. But chewing became harder. Her favorite foods lost their joy, and small sores began appearing along her gum line. When she finally went to the dentist, the news was sobering. The combination of undiagnosed diabetes and gum infection had been quietly eating away at her jawbone. The dentist compared it to trying to hold a fence post in soil that's slowly washing away. Eventually, nothing can keep it standing. The hidden culprit is sugar, More specifically, sugar lingering in the saliva when blood glucose levels are high. Bacteria in the mouth feed on it, like weeds thriving on fertilizer. They multiply, forming plaque and tartar that inflame the gums. The inflammation, in turn, makes it harder for the body to regulate blood sugar, creating a vicious cycle where each problem fuels the other. In this battle, brushing harder won't solve the issue. It requires a combination of controlling blood sugar and getting consistent dental care to stop the damage from advancing. When he finally understood this link, his daily habits changed. An electric toothbrush replaces old manual one. He rinsed with warm salt water after every meal, and he never skipped his dental checkups. Slowly, he noticed his gums becoming less tender and less red. The most surprising part? His dentist could often tell if his blood sugar had been stable just by looking at his gums. It was like having a built-in warning system, quietly sending messages about his overall health without saying a word. He now tells anyone who will listen that healthy gums are not just about keeping a nice smile. They're about protecting the ability to eat, to speak clearly, and to enjoy life without discomfort. For people over 60, especially those with diabetes, ignoring gum inflammation is like ignoring the smell of smoke in a house. By the time you see flames, the damage is already done. These days, he thanks God for the gift of catching it early enough to save his teeth, and for every meal he can enjoy without pain. Number 2, red, swollen gums that bleed easily. The first sign she noticed wasn't pain. It was a color. Her gums had taken on a deep, angry red, a far cry from the healthy pink she remembered. Then came the swelling, making it feel as though her teeth no longer fit quite right in her mouth. One morning, while brushing, she saw the toothbrush bristles turn pink from blood. She rinsed, hoping it was just from brushing too hard, but it kept happening. What she didn't realize was that bleeding gums could be an early warning sign of diabetes. For those with high blood sugar, the body's defenses against infection are weaker, and even a small amount of plaque can trigger intense inflammation. Her neighbor Bill had brushed off similar symptoms for months. A proud man who'd worked construction his whole life, he figured a little bleeding was just part of getting older. But as the weeks went by, his gums grew tender, and even eating soft bread felt uncomfortable. When he finally visited the dentist, the news was surprising. His gums were bleeding because of inflammation linked to high blood sugar. A follow-up with his doctor confirmed it. Type 2 diabetes. Bill often said later, "If my gums hadn't bled, I might not have known until it was too late." The science behind it is simple but alarming. High blood sugar changes the way the body heals, slowing down the repair of tissues like the gums. It also makes the blood vessels in the gums more fragile, which is why they bleed so easily. At the same time, the extra sugar in the saliva feeds bacteria, worsening the inflammation. That's why dentists often spot signs of diabetes before a physician does, because the mouth tells the story first. The redness, swelling, and bleeding aren't just cosmetic problems. They're red flags waving for attention. Once she learned the connection, she began treating her gums with more care. She switched to a softer toothbrush, flossed gently every evening, and rinsed with an alcohol-free mouthwash to avoid irritation. Just as importantly, she started keeping track of her blood sugar and paying attention to how her gums felt. On days when her sugar was stable, her gums bled less and looked calmer. It was proof that the health of the mouth and the health of the body walk hand in hand. Looking back, she realized those bleeding gums were a blessing in disguise, a small sign that led to a big discovery. Without them, she might have ignored the slow changes happening inside her body. Now, she tells her friends at Bible study, God gives us warnings in the smallest ways. Sometimes they're right under our nose, or in this case, just above our teeth. Number 3, persistent bad breath. He had always prided himself on keeping a clean mouth, brushing twice a day, flossing after supper, and even chewing a mint before church on Sundays. But lately, no matter what he did, a sour, unpleasant smell lingered. His wife noticed it first, gently offering him gum more often than usual. At first, he laughed it off, blaming the strong coffee he loved. But when even peppermint couldn't mask the odor, he began to worry. Persistent bad breath, he would later learn, can be more than a social nuisance. it can be an early sign of diabetes. When blood sugar is high, bacteria in the mouth multiply faster, producing foul-smelling compounds that brushing alone can't erase. Years ago, his old fishing buddy Tom faced the same problem. Tom was a man of few words, but even fewer mints could hide the scent that seemed to follow him. Friends whispered, thinking it was poor hygiene, but in truth, his diabetes was quietly feeding the bacteria in his mouth. The high glucose in his saliva created the perfect breeding ground for odor-causing germs. It wasn't until Tom's dentist suggested a blood sugar test that he discovered his condition. Looking back, he realized that bad breath had been his body's first warning sign. The reason this happens is simple yet overlooked. Elevated blood sugar weakens the immune system, making it harder to control bacterial growth. At the same time, many diabetics experience dry mouth, another side effect of condition, which reduces saliva's natural cleaning ability. Without enough saliva to wash away food particles and bacteria, odors become stronger and more persistent. That's why regular mouthwash or breath mints may cover the smell for a moment, but never truly solve the problem if high blood sugar is involved. Determined to turn things around, he made changes to his routine. He started drinking more water throughout the day to combat dryness, swapped out sugary mints for sugar-free ones, and used a tongue scraper every morning. Most importantly, he worked with his doctor to stabilize his blood sugar. Slowly, the bad breath faded, and with it, the uneasy feeling that something was wrong. His wife noticed before he did. One morning at breakfast, she leaned over and said, "You smell like coffee again, not trouble." Now, when he talks to his grandchildren, he tells them that bad breath isn't always about what you eat. It can be your body's way of asking for help. Sometimes, he says, God sends us the gentlest warnings. If you ignore them, they get louder. Mine started with a whisper in my breath, and I'm grateful I listened before it shouted. Number 4, accelerated tooth loss. She had always been proud of her smile, the kind that made neighbors wave when she walked down the street. But over the course of a year, she noticed something unsettling. Her teeth felt looser, almost as if they were shifting slightly with each bite. At first, she thought it was just her imagination. Then one morning, while enjoying toast and jam, she felt a sharp pain and realized one tooth was barely hanging on. For someone with diabetes, this wasn't just bad luck. High blood sugar can weaken the structures that hold teeth in place, accelerating the loss in a way that feels sudden but has been building quietly over time. Her brother-in-law, Frank, knew this all too well. A tough rancher with hands calloused from decades of work, he dismissed his loose teeth as just part of getting older. But when he lost 2 teeth in the span of 6 months, he finally visited a dentist. The x-rays told the story: bone loss in his jaw from severe gum disease, made worse by years of poorly controlled blood sugar. The dentist explained it plainly. Your gums are the soil, your teeth are the plants. If the soil erodes, the plants can't survive. For Frank, the realization came late, but it changed the way he cared for his mouth and his health. The connection is rooted in inflammation. Diabetes reduces the body's ability to fight infections and slows healing, which means that once the gums and bone around the teeth are damaged, repair becomes difficult. At the same time, excess sugar in the mouth fuels bacterial growth, worsening the infection. Over months or years, the bone holding the teeth can shrink away, leaving them unstable. This isn't just a cosmetic concern. It affects chewing, digestion, and overall quality of life. Losing teeth also makes it harder to enjoy nutritious foods, which can further complicate blood sugar control. Once she understood the danger, she made preserving her teeth a top priority. She started seeing her dentist every 3 months instead of twice a year, and she worked closely with her doctor to keep her blood sugar in check. She added more calcium-rich foods to her diet and made sure to clean her teeth thoroughly after every meal. Slowly, her dentist noticed improvement. The swelling eased, and her teeth felt more secure. It wasn't a quick fix, but it was a lifeline for her smile. Now, when she talks to her church friends over coffee, she warns them not to ignore the signs. Teeth don't just fall out overnight, she says. They send little signals first. And if you listen early, you can keep them for life. She thanks God every time she bites into a crisp apple without worry, knowing that the effort she puts in a day is a blessing she'll enjoy for years to come. Number 5. Dark patches on the skin. He first noticed them in the bathroom mirror, a faint shadow on the back of his neck that didn't wash away with soap. Over the months, the patch grew darker and spread, feeling slightly velvety to the touch. He figured it was just age spots, something most folks get after a certain birthday. But during his next checkup, his doctor leaned in and explained that these darkened patches, especially on the neck, armpits, or groin, can be a sign of insulin resistance, often appearing years before diabetes is diagnosed. For him, it was unsettling to think that his skin had been whispering a warning while he went about his days, unaware of the storm building inside. His friend Mary had a similar experience. A retired schoolteacher with a sharp wit, she had always been careful about her appearance. When a dark patch appeared along her collarbone, she tried creams, scrubs, and home remedies, but nothing worked. It wasn't until her granddaughter, a nursing student, mentioned that it could be related to blood sugar that she booked an appointment. Tests confirmed type 2 diabetes. The patch told the truth before the blood test did, she later said, shaking her head in disbelief. The reason these patches form is tied to how the body processes insulin. When cells become resistant to insulin, the body produces more of it, and high insulin levels can trigger the skin cells to grow faster, producing extra pigment. The result is an area that's darker, thicker, and softer than surrounding skin. While not painful, these patches are a visible sign that something is off in the body's sugar management. In some cases, they fade with improved blood sugar control, but their appearance should always be taken seriously. When he finally understood what those marks meant, he began paying closer attention to other subtle changes in his body: dry mouth, fatigue, and frequent thirst. He also started making adjustments, cutting back on refined carbs, walking after dinner, and checking his blood sugar more often. As his health improved, the patches lightened slightly, but more importantly, he felt better and stronger overall. His doctor told him, "Your skin was your messenger and you listen in time." These days, when he sees someone dismissing a strange mark as just aging, he gently shares a story. Sometimes, he says, God doesn't send a loud alarm, just a small sign on your skin. It's up to you to notice it before it's too late. For him, those patches were a blessing in disguise, a warning that led him to a healthier, more mindful way of living. Number 6. Persistent itching. It started as a mild annoyance, an itch under his arm that came and went. At first, he blamed the summer heat or maybe the detergent his wife had recently switched to. But as weeks turned into months, the itching didn't fade. In fact, it spread to other areas, particularly the folds of skin where it stayed warm and slightly damp. He tried lotions and powders, but nothing worked for long. Only later did he learn that persistent itching, especially in areas like the armpits, groin, or behind the knees, can be linked to diabetes. High blood sugar can cause poor circulation and dry skin, both of which make itching worse, and infections can develop more easily when the skin barrier is weakened. His cousin Elaine remembered having the same trouble years earlier. A lively woman with a big laugh. She'd been embarrassed to talk about it first, thinking it was just a personal hygiene issue. She avoided wearing sleeveless dresses and skipped swimming at the community pool. But the itching kept her awake at night, and small rashes began to appear. When she finally mentioned it to her doctor, he ordered blood tests. The results showed type 2 diabetes. Elaine often says that finding out was a blessing, because treating her blood sugar helped clear her skin and gave her back her confidence. The science behind it is simple. High blood sugar can lead to nerve changes and reduce moisture in the skin, creating dryness and irritation. At the same time, yeast and bacteria thrive in sugar-rich environments, and for someone with diabetes, that means more frequent skin infections. These infections cause even more itching, creating a frustrating cycle. Without treatment, small irritations can turn into sores that take a long time to heal, especially when circulation is already compromised. Once he understood the connection, he took steps to manage it. He began moisturizing daily with unscented creams, wearing loose, breathable clothing, and keeping his blood sugar within his target range. He also made sure to treat any skin redness right away instead of waiting for it to worsen. Over time, the itching subsided and the constant discomfort faded into memory. His sleep improved, his mood lifted, and even his appetite for life seemed to return. Now, He tells folks at the senior center that itching isn't always just about dry air or summer sweat. Sometimes, he says, it's your body waving a flag before you even know there's a battle going on inside. For him, paying attention to that itch was the first step toward avoiding bigger problems. And every morning he wakes up without scratching, he silently thanks God for the relief. Number 7, sudden blurred vision. She had always been proud of her sharp eyesight, the kind that let her thread a needle without glasses well into her 70s. But one afternoon, while reading her favorite devotional, the words on the page began to blur. She blinked, rubbed her eyes, and tried adjusting the light, but nothing helped. By the next day, it was worse. Her first thought was that she needed a stronger prescription, but the optometrist had a different answer. Fluctuating blood sugar levels were changing the shape of the lenses in her eyes, causing sudden blurred vision. For someone with undiagnosed diabetes, this could be one of the earliest and most surprising symptoms. Her neighbor Robert had gone through the same thing. A retired postman. He prided himself on knowing every mailbox in town, but one morning he couldn't clearly see the numbers on the street signs. He thought he was just tired or needed to clean his glasses, but within weeks, his vision came and went like a faulty camera lens. His eye doctor suggested a blood test, and sure enough, his glucose levels were dangerously high. Robert later said that if he'd ignored his vision problems, he might have gone months before discovering the truth. The science behind it is straightforward. High blood sugar draws fluid into the lens of the eye, causing it to swell and temporarily change shape. This makes focusing difficult, leading to blurry or distorted vision. In some cases, vision can return to normal once blood sugar stabilizes, but repeated spikes and crashes increase the risk of long-term damage, including diabetic retinopathy. That's why sudden vision changes, especially when they appear and disappear, should never be dismissed as just getting older. Once she understood the cause, she took steps to protect her eyes. She began checking her blood sugar more often, walking after dinner to help her levels stay steady, and making sure to drink enough water throughout the day. Her vision gradually cleared, and her eye doctor confirmed there was no permanent damage. She felt relieved, but also determined to never take her sight for granted again. Now, when someone at church mentions they've been having blurry vision, she gently shares her story. Your eyes are more than windows to your soul, she says with a smile. They're windows into your health. For her, that one blurry page in her devotional turned out to be a clear sign from God, reminding her to take care of the body He gave her before the damage became irreversible. Number 8, extreme fatigue. He had always been an early riser, the kind who could split wood before breakfast and still have energy to tend the garden by mid-morning. But lately, even simple tasks felt like climbing a hill with a heavy load. Mowing the lawn left him needing a nap, and walking to the mailbox felt like a chore. At first, he blamed it on age. After all, the calendar doesn't lie. But deep down, he knew something wasn't right. Extreme fatigue can be one of the earliest and most persistent signs of diabetes, caused by the body's inability to use glucose efficiently for energy. Instead of fueling the muscles, sugar stays trapped in the blood, leaving a person feeling drained no matter how much they rest. His sister June had felt the same bone-deep tiredness years before. A retired nurse. She was used to long shifts and little sleep, but this was different. Even after a full night's rest, she woke up exhausted. She'd pour her morning coffee, hoping it would help, but by mid-morning, she was fighting to keep her eyes open. When she finally went to the doctor, she learned her blood sugar levels were high enough to explain everything. Treating her diabetes didn't just protect her from future complications. It gave her energy back and restored her zest for life. The reason fatigue hits so hard in diabetes is that without enough insulin, or with the body resisting it, cells can't absorb sugar from the blood to make energy. At the same time, high sugar levels cause dehydration, which only worsens a feeling of exhaustion. The result is a double blow, tired muscles, and a tired mind. Over time, this constant fatigue can affect mood, motivation, and even relationships as daily activities become harder to enjoy. Once he realized this wasn't just old age, he began making small but steady changes. He adjusted his diet to include more balanced meals, started walking after dinner to help his body process sugar, and kept a regular sleep schedule. Within weeks, He noticed a difference. He could mow the lawn without stopping halfway, and his afternoons no longer required a nap. The sense of accomplishment was almost as energizing as the physical improvement. Now, when friends at the diner complain about feeling worn out all the time, he leans in and says, "Don't just blame the years. Sometimes your body's tired because it's working too hard on the inside." For him, that season of fatigue was more than just a slowdown. It was a warning from God to take better care of himself before the road ahead got too steep to climb. Number 9, burning sensation in the feet. It began as a faint tingling, like pins and needles after sitting too long. At first, he thought nothing of it, just poor circulation from crossing his legs too often. But over the months, the sensation changed. It became a persistent burning in the soles of his feet, sometimes keeping him awake at night. He tried new shoes, foot creams, even soaking them in warm water, but nothing brought lasting relief. What he didn't realize was that this was more than a minor irritation. It was a possible sign of diabetic neuropathy, a nerve problem caused by prolonged high blood sugar. For many, this burning can be the first sign of damage to the nerves, long before other complications appear. His old bowling partner, Carl, remembered the same struggle. A man who'd spent decades on his feet at the local hardware store. Carl assumed it was just a wear and tear of life. But when the burning turned into occasional numbness, he knew something was wrong. His doctor explained that high blood sugar damages the tiny blood vessels that supply nerves, especially in the feet and legs. Without proper care, the damage can worsen, leading to loss of sensation, balance problems, and even serious infections. Carl wished he had paid attention earlier, before the discomfort became constant. The science behind this symptom is straightforward but alarming. Excess glucose in the blood over time can injure the protective coating on nerves, disrupting the signals between the brain and the body. That's why some people feel burning, tingling, or sharp pain, while others lose feeling altogether. Because the feet are farthest from the heart, they're often the first to be affected. And without the ability to feel pain properly, small cuts or sores can go unnoticed and become dangerous. Once he understood the risk, he began caring for his feet as if they were fragile treasures. He checked them daily for any cuts, wore soft, well-fitting shoes, and kept his blood sugar within target range. Gentle stretching and walking helped improve circulation, and moisturizing kept the skin healthy. Gradually, the burning eased, and his nights became more restful. His doctor told him that by catching it early, he had likely prevented more serious nerve damage. Now, when he talked to other men at the Veterans Club, he shares a story without hesitation. God gave us warning lights, he says, and sometimes they're in our feet. Don't wait for the fire to spread before you put it out. For him, that burning sensation turned out to be the signal that saved more than just a step. It preserved his independence. Why these signs appear? He used to wonder how one illness could cause so many different problems. Bleeding gums, blurry vision, itchy skin, and burning feet all seemed like separate issues. But as his doctor explained, they were all connected by one thing: high blood sugar. When glucose levels stay elevated for too long, it's like a slow flood running to the bloodstream, touching every organ, every nerve, and every tissue. The body's repair crews, the immune system and healing processes, get bogged down, leaving small problems to grow unchecked. In the mouth, that means more bacteria and gum disease. In the eyes, swelling and vision changes. In the skin and nerves, irritation and damage. It's all part of the same story. His friend Alice, a retired librarian, described it in a way he never forgot. She said, "It's like having syrup in your veins instead of water. Everything moves slower, sticks more, and wears out faster. That sticky environment makes it harder for oxygen and nutrients to reach the places they're needed, like the tips of the toes or the roots of the teeth. And without enough oxygen, those tissues become weak and vulnerable to infection. That's why so many seemingly unrelated symptoms can actually be traced back to the same hidden cause. High blood sugar also affects the blood vessels themselves. Over time, it can cause them to become narrower and less flexible, reducing circulation. This makes healing slower and infections harder to fight. Nerves, which rely on a steady flow of nutrients, begin to malfunction. That's why someone might feel burning in their feet or numbness or strange tingling sensations. And because the mouth is full of tiny blood vessels, Even the gums suffer from poor circulation, leading to swelling, bleeding, and tooth loss. Once he understood this, he realized that managing diabetes wasn't just about avoiding sugar. It was about protecting every part of his body. He began to see his meals, his walks, and even his dental appointments as tools to keep that syrup from slowing him down. Over time, his energy returned, his mouth felt healthier, and his vision stayed clear. It wasn't magic. It was a result of steady, mindful choices. Now, when people ask why diabetes causes so many strange problems, he smiles and says, because the body is one big neighborhood. If one street floods, it's only a matter of time before the water reaches the others. For him, learning why these signs appear turned confusion into action, and action into a healthier, more grateful life. When to see a doctor, she had always been the type to wait and see when something felt off. A sore knee? Give it a few days. A cough? Drink tea and rest. But when it came to her mouth, bleeding gums, a strange taste, and a burning feeling on her tongue, those small annoyances were easy to dismiss until they became part of her daily life. That's when her daughter convinced her to see both the dentist and the doctor. Within a week, she learned she had type 2 diabetes. Looking back, she realized that waiting had cost her time she could have spent protecting her health. The lesson was clear. When unusual symptoms appear and don't go away, it's time to make that appointment. Her friend Harold, a retired mechanic, learned the same lesson in a harder way. He ignored a persistent mouth sore for months, brushing it off as nothing serious. But when it grew worse and his teeth started to loosen, he finally sought help. The dentist suspected something more than gum disease and urged Harold to get his blood sugar tested. The results confirmed it. Diabetes was the underlying cause. Harold often says that if he had gone in earlier, he could have saved himself months of discomfort and the cost of major dental work. The truth is, dentists are often first to spot signs of diabetes. They can see patterns, bleeding gums, slow healing sores, unusual dryness, that point of more than just poor brushing habits. Doctors, too, can connect the dots when symptoms like fatigue, skin changes, and nerve pain appear together. That's why the best approach is a team effort, keeping both dental and medical checkups on the calendar. Once she got her diagnosis, she stopped thinking of appointments as chores. Instead, she saw them as investments in her future. She wrote down any changes she noticed, no matter how small, and brought that list to each visit. Sometimes the doctor would wave off her concerns, but other times those notes led to important adjustments in her care. The peace of mind alone was worth it. Now, she tells her Bible study group, don't let pride or fear keep you out of the doctor's office. God gave us these bodies, and it's our job to take care of them. For her, making that first appointment wasn't a sign of weakness. It was an act of wisdom that gave her more healthy years to enjoy with her family. He never imagined that something as ordinary as brushing his teeth or checking his skin in the mirror could lead to discovering a serious condition like diabetes. But now, looking back, every small symptom made sense. Bleeding gums, patches on the skin, that unexplained fatigue. Each one had been a clue, a small tap on the shoulder from God, urging him to pay attention before things grew worse. For anyone over 60, these signs are not just inconveniences. They're opportunities, chances to step in early, make changes, and protect the life and independence they still enjoy. His neighbor Ellen often said, "The body keeps talking until you listen." She was right. Whether the persistent itch, sudden blurry vision, or a burning in the feet, these signals are worth more than a passing glance. The mouth, especially, is like an early warning station, broadcasting trouble before it fully sets in elsewhere. Ignoring it means losing valuable time, and time is something you can't get back once the damage is done. That's why he began sharing his story with anyone who would listen, at the diner, at church, even while waiting in line at the grocery store. He wanted folks to know that paying attention to their mouth and skin could save them from losing their teeth, their vision, or worse. And it doesn't cost much to be watchful, just a little time, a little care, and the willingness to see a doctor when something feels off. For those already managing diabetes, these same signs can be reminders to check their sugar levels, keep appointments, and make the small daily choices that keep complications at bay. For those without a diagnosis, they can be the first step toward catching the disease early enough to make a big difference. Either way, knowledge is a form of protection, one that no one should go without. As he often says at the end of his talks, your body is speaking. Your mouth might be telling you what your blood hasn't shown yet. Listen before it's too late. He always ends with a warm smile and the same words. Take care of yourselves and God bless y'all.